Hello, everyone. I'm pharmacist Imwejuvoke Ode. Today, let's discuss a vital topic that affects us all and has the potential to become the next pandemic. And this is the misuse of antibiotics and the emergence of superbugs or antibiotic-resistant bacteria. Now, you may want to ask, what are antibiotics? Antibiotics are medications designed to kill bacteria that cause infections. However, in recent times, their effectiveness is being threatened by misuse and overuse. Now, let's dive into understanding antibiotic resistance. When antibiotics are used too often or incorrectly, bacteria can adapt and become resistant. Right? This means the same antibiotics no longer work against this bacteria. This means the same antibiotics your physician, your pharmacist has been using or has used will no longer work. Now, making infections harder to treat. So, what are the consequences of misusing these antibiotics? 1. Harder to treat infections. Resistant bacteria can cause infections that don't respond to standard treatments, leading to longer illnesses and more doctor visits. Meaning, you will have to visit your physician several times, meaning you will have to visit the hospital several times. Now, another reason is spread of superbugs. This resistant bacteria can spread to others, increasing the risk of untreatable infections in the community, further leading to illness and death. And we don't want this. Another reason is limited treatment options. Yes, we would be left with limited treatment options. As resistance grows, the antibiotics we rely on may no longer be effective, leaving fewer options for treatment. And we don't want that. So how can you help? How can I help? We can help by the following ways. Use antibiotics wisely. Only use antibiotics when prescribed by a healthcare professional. Follow prescriptions exactly as prescribed. Also, ensure to complete the full course as directed, even if you feel better. Yes. Never share or use leftover antibiotics. It's for my mom, it's for my dad. I'm going to use it. No. Medication should be tailored to your specific illness. Prevent infection by regular hand washing and staying up to date with vaccinations, as this can reduce the need for antibiotics. Please, let's all join the fight against superbugs by using antibiotics responsibly. We can therefore slow the spread of resistance and ensure these life-saving medications remain effective for future generations. Again, avoid pressuring healthcare professionals, your healthcare providers. Sometimes we pressure physicians to prescribe antibiotics when they are not needed, and this is not necessary. For example, antibiotics don't work against viruses like the common cold, the flu, and COVID-19. You heard me right? Yes. Understand the causes of antibiotic resistance. This antibiotic resistance, what are the causes? 1. Overprescribing of antibiotics. 2. Not taking antibiotics as prescribed. Again, some people misuse them for purposes like flushing the body or as contraception, which is inappropriate. It's a myth, and we must disregard that. Unnecessary antibiotic use in agriculture. Many food animals are routinely treated with antibiotics to promote growth, contributing to resistance. Yes. Another factor is poor infection control in healthcare settings. Also, poor hygiene and sanitation practices. Lack of rapid laboratory testing. We know caution sensitivity test takes 48 hours. Now, what are the steps to curb this problem? Healthcare professionals should continue to stay informed about appropriate antibiotic use. 2. For laboratory testing, urine caution and sensitivity tests can guide effective treatments to avoid misuse, irrational use, and antibiotic resistance. Let's maintain proper hygiene and sanitation and help to prescribe medication dosages. By taking these steps, we can combat the threat of antibiotic resistance and protect public health. Thank you for your time. I appreciate you all.